We would be remiss if we talked about health in the Eastern Mediterranean region and did not talk about polio. There are two countries left in the world where wild polio virus spreads, and they are both in this region. It's a devastating disease. It causes paralysis in the children that get sickened by it, and it is completely preventable because there is a vaccine to go with it. WHO and some very strong partners have been working to eradicate this disease, and really good progress has been made. If you look back in 1988, 350,000 cases of polio were in the world. So far this year, Chris, correct me if I'm wrong, but I think we're at less than 50 globally. So that is huge progress. It is absolutely formidable work, and I wanted to start our discussion on the bigger picture of what we are doing globally to eradicate this disease. But I also, if we have the luxury of time, hope to go into a recent outbreak that Elizabeth mentioned in Syria in 2013, where we can see a really good case study, I think, on what it takes to snuff out an outbreak, and perhaps that can give us an example of what we're going to need to do globally. Joining me now, Dr. Chris Maher. He is one of the managers in this region for polio, and he is based in Oman and was literally firsthand frontline with snuffing out the outbreak that occurred in 2013 in the Middle East. Chris, let's start at the big picture, if you would. There's two countries left in the world, Afghanistan and Pakistan.
That's correct.
What are we doing to try to get rid of polio there?
Both of those countries have, over the past several years, been operating under what they call national emergency action plans. So for the last 4 or 5 years, polio has been considered a global public health emergency. So each of the countries that are infected, and particularly the endemic ones like Pakistan, Afghanistan, and up till recently Nigeria, were operating under an annual emergency plan, a process of trying to identify what was happening, why polio was still circulating, who it was circulating in, and what they had to do to stop it, which of course is immunisation basically.
Mm-hmm. How hard is it to get to the children that need to be immunized in these countries?
You know, if you try to illustrate the point, imagine, any of us from wherever we come from, imagine trying to immunize between 15 and 20% of your national population in 3 days. And I don't care what country it is, even under perfect circumstances, this is an extremely difficult thing to do. When you add to that the countries, most of the countries facing polio as a problem are less developed countries with infrastructure difficulties, logistical difficulties, operational difficulties, governance difficulties, and then security concerns on top of everything, civil war, civil conflict, then you get an understanding of how difficult it is to reach every child.
Well, let's look at the outbreak in Syria then, maybe as an example there. So the Middle East had not had a polio problem for quite some time. I think it was a decade for Iraq,
Yes.
if I remember correctly. Then you have the crisis in Syria,
Yes.
and you have more than 7 million people displaced by the end of 2014. Lack of health services, lack of health workers, lack of supplies. Suddenly, your highly immunized population is no longer as protected as they were. Then you get cross-border movement. What was your reaction when you first heard that there was a polio case in Syria?
I remember actually even before the outbreak began, and a few of us were sitting around one day thinking about what would be our worst nightmare situation, and it was actually that we had an outbreak in Syria, and that's exactly what happened. I remember very clearly the early response to the outbreak, and interestingly, you were saying it's a bit of a textbook case in some ways. It is. It's one of the great success stories, I think, of polio eradication and probably of outbreak response globally in general, where very early on you had multiple countries agreeing to a coordinated plan, a coordinated approach, immunising more than 20 million kids across 8 countries multiple times. To bring the outbreak under control. So it was quite a fast response. It was quite a coordinated response between the countries, and ultimately it worked.
In an emergency like that, how do you get to the hard-to-reach areas because it does no good if you leave gaps
Yeah.
in vaccination coverage. How do you get there? What did you do in
In both Syria and Iraq, it was extremely difficult, I have to say. And what we were fortunate with, very fortunate with, in both countries, despite the conflict situations, is that there was a very significant public health capacity, if you like, in both countries prior to the crisis. So those people were still there. It's not that that whole structure had disappeared. There was still that structure. So no matter who effectively was the local authority in any particular area, there was still a public health capacity that existed. And provided we could access that public health capacity, we could do things. And that's what happened. Ultimately, in every area, we were able to identify people between us, the governments, the partners, identify people who could carry out immunisation activities and then who did it.
Describe for me what this immunization campaign looks like. I don't know that all of our viewers know what happens in a mass vaccination for polio. And how long did it take to get the Syria outbreak under control?
In a classical sort of polio response, what should happen, or classical polio campaign, what should happen is that someone will pass, a vaccination team will pass house to house in a particular catchment area that belongs to them. And in every house, they'll identify all the kids under 5 and vaccinate them. And any kids who are not under 5, or who aren't there at the time when they're immunising, they'll come back and immunise them later, or they will arrange for the parents to bring them to a health facility or something. That's the sort of ideal base situation. In Syria and Iraq, of course, it's a hell of a lot more complex than that because there was a war going on and because of the population displacement that had happened. I mean, you didn't really have the same sort of formal household sort of situation that you usually do. So the activities were much less structured, if you like, in a classical sense. But the two big positives were this very well-trained health workforce, very powerfully motivated, very, very interested in reaching kids and immunising them, and a very strong health-seeking behaviour from families, very strong knowledge of immunisation and a very strong desire to have their kids immunised. So between those two things, even though we couldn't always take the classical approach, as long as immunisation teams could get to communities, children tended to get brought out and immunised.
So how many people did you vaccinate and how long did it take to shut it down?
Across the whole region, across the 8 countries, the largest campaigns were targeting more than 20 million children per round. In Syria and Iraq, between the two of them, the target population was around 6 million kids under 5.
Wow.
So, they're pretty significant undertakings.
Well done. And thank you very much for coming by and briefing us on this, but it really does show the amount of effort that's going to be needed to eradicate this virus completely in these last 2 countries. Thanks for your time, and thank you and your team
My pleasure,
for what you do. Really, really impressive work.
Thank you.